So our divisions of the autonomic nervous system and are the sympathetic division and the parasympathetic division. Most of your glands, your visceral organs, are served by both divisions, but they cause opposite effects. The parasympathetic division keeps body energy use low as possible while directing digestion, promoting blood flow in those digestive organs, and elimination or pooping, waste elimination, urinating activities. The sympathetic division prepares the body to respond to an emergency or threatening situation, or vigorous exercise. So we're going to discuss the anatomy of the two different divisions now. So in the parasympathetic division, the preganglionic axons extend from the central nervous system nearly all the way to the structures to be innervated, where they synapse with ganglionic neurons in the terminal ganglia. The cranial outflow consists of preganglionic fibers, so that first neuron fibers that run in the oculomotor, facial, glossopharyngeal, and vagus nerves. So let's take a look at the parasympathetic neurons here. We have these preganglionic axons coming from cranial nerves that innervate the eye, salivary glands, heart, lungs, stomach, pancreas, liver, and gallbladder. And then we can see that the bladder and the genitals, so the rest of the large intestine and these pelvic organs that I just mentioned are served by preganglionic nerves that come out of the sacral outflow. And this would be located in the lateral gray matter of the spinal cord in the sacral section of so this would be S2 and S4. So let's go back a little bit. In the sympathetic nervous system, sympathetic part of the division of the autonomic nervous system, the fibers originate from the thoracolumbar region of the spinal cord, and this supplies the visceral organs in the internal body cavities, but also all visceral structures in the somatic part of the body. There's different ways these synapses, the preganglionic nerve fibers can synapse, and I'll show you some different pictures of that. So, but general characteristics, we tend to have short preganglionic fibers and long postganglionic fibers, and your ganglia are close to the spinal cord. So here you can see we have short preganglionic fibers, and then a lot of them synapse in these sympathetic ganglia and have long postganglionic fibers. Okay, so just to go over the parasympathetic stuff real briefly again, we have cranial outflow, we have these long preganglionic, presynaptic, or preganglionic axons, and they come from cranial outflow and sacral outflow to innervate those visceral organs. Let's get back into the show. The sympathetic nervous system, most of the preganglionic neurons are in the spinal cord segments of your thoracic and upper lumbar segments. These sympathetic neurons are what produce the lateral horns of that butterfly in the spinal cord. They're the sort of in the butterfly wings of the spinal cord. They're the bumps on the side of the wings. The preganglionic fibers can pass through those white rami communicantes, which we've seen before, and then enter sympathetic trunk ganglia. So we can see right here, these lines indicate white rami communicantes, and then we've got this chain ganglia here, this big group of of cell bodies that form sympathetic nervous system. It's a sympathetic nervous system ganglia, basically a big chain of cell bodies. So we kind of got into some complicated pathways there, but upon entering one of these preganglionic fibers, when they enter a sympathetic trunk ganglia, they can do one of two things. They can synapse with a ganglionic neuron within the same ganglion, or they can ascend or descend the sympathetic trunk to synapse in another trunk ganglia, or they can just pass through the trunk ganglia and emerge without synapsing. So here's a picture of that lateral horn, to put things in perspective. These are motor fibers, so they come out the ventral side, and we've got our ventral root, our spinal nerve. This is this sympathetic fiber traveling down its pathway, and then we've got the spinal nerve entering one of these white ramus communicantes, and then entering a sympathetic trunk. And so this is a ganglion right here, where there'd be a collection of sympathetic cell bodies. And so this synapse would be synapsing at the same level of the spinal cord. You can see here we can synapse at a higher or lower level. We can travel up that ganglia, or we can synapse, don't even synapse in that ganglia, or synapse at a distant ganglia that's anterior to the vertebral column, and then our postsynaptic fiber would innervate its target organ. So visceral sensory neurons are a link, the first link in autonomic reflexes. They send information concerning chemical changes, stretch, and irritation of the viscera. And then we have visceral reflex arcs that help take care of maintaining homeostasis. Visceral reflex arcs have the same components as somatic reflexes, like spinal reflexes. And the main difference is that we usually have two neurons in the motor pathway. And visceral pain afferents, things that transmit sensation of pain from your viscera, travel along the same pathways as somatic pain fibers. So sometimes you can get to a phenomena called referred pain. So here we have a sensory receptor in your viscera. The sensory, remember, the sensory neurons have their ganglia here, their cell bodies here. They synapse somewhere in the spinal cord, and then we have an integration center. This may be a preganglionic neuron or a dorsal horn interneuron. But then instead of just one neuron coming out, we have two that chain together. We have this efferent pathway, two neuron chain, we have a preganglionic neuron, and then our ganglionic neuron. And then we have our visceral effector, which would carry out the response. Okay, in the next movie, we're going to talk about neurotransmitters and how they differ between the two systems.